Hello, everyone, and welcome to the 2021 Rally for Recovery. I'm super excited to be here. My name is Evan Doan, and I am a person in long-term recovery from both a substance use disorder and a mood disorder. And right now I serve as the development director for the Utah Support Advocates for Recovery Awareness, which is why I'm here with you tonight. It's really hard to believe that it was just a year ago that the picture behind me was taken of the last rally that we had up at the Utah State Capitol. Usually for this event, we pack the Capitol Rotunda full of people in recovery, which is a really amazing sight to behold. But this year has been different, and I think that for many of us in recovery from substance use and mental health conditions, it's been a hard year. It's been difficult. But what I know is that people in recovery are remarkably resilient, and we've really seen that come out this year. I was asked by a reporter a couple of weeks ago how I felt about being a person in recovery in the midst of a pandemic, and what I said was that I feel hope. I feel that recovery in and of itself is inherently a hopeful act, because it takes hope to believe that things can and will get better. And I think that that's true in this situation as well. We'll weather through the storm and we'll see a better day. So thank you for joining us tonight. And I'm going to go ahead and introduce a couple folks. First, we'll get started with the executive directors of USERRA and of NAMI Utah. So I'll first start with Mary Jo McMillan, Executive Director of USERRA.
Thank you, everybody. Well, thank you, Evan. And welcome, everybody, to our virtual rally for addiction and mental health recovery in the state of Utah. I am a woman in long-term recovery, and I am 35 and a half years in recovery from a substance use disorder, eating disorder, and mental health disorder. So I've learned how to live a life with a lot of support and a lot of coping, and very fortunate to get to be part of a much larger recovery community that is watching this rally virtually. And joining in a different way than we have done it in the past. I am grateful to work with people in recovery. USERRA is an organization that's led by peers who are individuals in their own recovery, and also family members who are in their own recovery, and how we support people to engage in the health in their own lives and build on their own recovery is to connect them with each other. And I think that our community is inspired by the connection and the stories that we share amongst each other. And USERRA's mission is to connect and inspire communities to always advocate for addiction recovery and mental health and wellness in our lives. And we've really seen Utah. We have a vision for Utah where people in recovery connect with each other, and we're the solution. I think I learned a lot about recovery from people all over the United States who were participating in what we call recovery movement, and even our federal government, the Substance Abuse and Mental Health Services Administration, really recognized that recovery was a state of somebody working on their own well-being, and really saw that it was very much an individualized definition that we own for ourselves in how we how we do self-care and how we provide support and care to other people. And I think out of that, and personally speaking in my own life, recovery changed everything. Once I had some information, I had some education, I had some treatment, and I had recovery support, I was able to thrive in my recovery. And I think that is certainly the foundation of what we're able to do in our state to help others in their own recovery. And so it's really with our own voices that we eliminate the stigma that we often experience and people who feel marginalized and discriminated against because they have mental illness, substance use, are struggling in a way that they're afraid to talk about it. We have to bring our voices to talk about it so people feel free to connect to someone and let them know when they're struggling so that they can find the hope and the help that they need. So I'm very grateful to be here today virtually with my colleagues and friends and all of you that are watching. Thank you.
Thank you so much, Mary Jo. So next I'll introduce Rob Westman, the Executive Director of NAMI Utah.
Thanks, Evan, and thanks, Mary Jo. Yeah, my name is Rob Westman. I'm the Executive Director for NAMI Utah. And I too am excited to be here. And when I jumped on and I saw the background pictures, it really kind of took me back to the years past that we've been able to do that. And we all kind of talked about, boy, it's going to be cool when we can do that again. But right now, what we're really focusing on, and Mary Jo mentioned this, is that continuation of connections. I mean, that really is the key to keeping people, you know, safe, stable, in a state of recovery. And it's been a challenge this year, as Evan mentioned. It's been a tough year for folks, and I think what that's brought, and again, Evan mentioned this, the resilience of folks to figure out different ways to do it, like we're doing here. If you had said a year ago, oh, we're going to meet via a virtual space many times a day and it's going to be the standard, I think we all would have shaken our heads and thought that's silly. But now what we have is a space where, you know, NAMI has been able to reach folks that we couldn't reach before, that they were physically distant, they were unable to get to a physical space. And I love the fact that out of this chaos and out of this very strange year, folks have said, well, we want to stay connected and this is how we're going to do it. And getting back to something Evan said also, it's hopeful. And I too am very hopeful. I feel very hopeful every time I get to say 2021, because that is a very hopeful number to me and to folks at NAMI. And so I just appreciate everyone being here, because this is the way that we will stay connected through all of this as we, you know, come together in the future via every method we possibly can, this way, in person, and whatever else we think of. So I just thank everyone for being here, and I look forward to a great year.
Thank you so much, Rob. That was excellent. So let's see, I'm looking around the room to see who we should have up next. Let's invite Brent Kelsey from the State Division of Substance Abuse and Mental Health up to share with us for a moment.
Thanks, Evan. I appreciate it. Brent Kelsey, I'm the Assistant Director of the Utah Division of Substance Abuse and Mental Health. And I want to thank everyone who's participating tonight. And I especially want to thank the people in recovery who, through sharing their stories, have become the faces of recovery in our community. I have worked in this field for over 20 years. And as I was thinking about this opportunity to speak tonight, I started looking back on some of the accomplishments and the progress that we've made over the past 20 years. And I wanted to talk a little bit about some of those accomplishments. Medicaid expansion, which occurred a few years ago, gave us the opportunity to dramatically expand the size of our treatment system and provide treatment opportunity to thousands of Utahns. And I don't think that would have happened without people in recovery speaking out about the need for expanded treatment services. We've added 117 licensed recovery residences to the continuum of care in the state of Utah. And in Salt Lake County alone, they serve over 1,000 people a year. The creation of USARA and this growing recovery movement has had influence on legislators, on stakeholders, on executive branch officials, and really changed the conversation about addiction and substance use disorder in our community. And I want to thank all of you that have been involved. We've fought battles together on expungement laws, and we've given people in recovery who've had criminal records the opportunity for a clean start. And this helps them rejoin the community, which is critically important. The idea that we would have harm reduction efforts moving forward in Utah, syringe exchange programs, naloxone distribution, that would have been almost impossible 20 years ago. But now we're moving forward on those kinds of efforts, which save lives and are critically important. I don't think that would have happened without this recovery effort. And we're also seeing now an expansion in medication-assisted treatment, and we're reducing the stigma associated with medication. And I think that's critical. We're not done. We still have a tremendous amount of work to do. And I wanted to share with you some work that's being done at the national level from Faces and Voices of Recovery. So I'm going to try and actually share my screen. Faces and Voices of Recovery is talking about a recovery bill of rights. And I love this effort because I think it encapsulates much of the work that we still need to do. This is a public health problem, and we need to treat it like a public health problem. And people in recovery have a right to be viewed as capable of changing and growing and being positively connected to the community. And USARA and this rally helped with that effort. We have a right, as do our families and friends, to know about the many pathways to recovery and the nature of addiction. And we have a responsibility to educate people in our community about substance use disorder. We have a right, whether seeking recovery in the community, a physician's office, treatment center, or while incarcerated, to set our own recovery goals. We have the right to select services that build on our strengths. We have the right to be served by organizations or healthcare and social service providers that view recovery positively. We have the right to be considered as more than a statistic. We have the right to a healthcare and social services system that recognizes our strengths and the needs of people with substance use disorder. And I think some of the bills that are moving forward this year, I love the fact that there's going to be additional resources provided to the Office of Licensing to strengthen our regulation of youth treatment programs. That's a critical goal, I think, that we should all share. We're past the days where we should expect anything other than evidence-based care. We have the right to be represented by informed policymakers. And I'll tell you, this rally, people in recovery have done more to educate legislators, mayors, council, commissioners, county commissioners about substance use disorder than anyone else. Your stories matter, and you've truly made a difference by holding events like this. We have a right to respectful, non-discriminatory care from doctors and physicians and from our healthcare system. We have a right to treatment and recovery support in the criminal justice system. And I think we have to remain actively involved in efforts to reform our justice system to make sure that people with substance use disorder are treated fairly and they get the care they need. And we also have the right to speak out publicly about recovery. And so I'm thankful to those of you who do. And I want you to know that the division is an ally. We still have a lot of work to do, but I know that together we can accomplish even more. And thank you for the opportunity for letting me speak. And I'll stop the share.
Thanks so much, Brent. I really enjoyed that. And I really appreciate that you brought in how changes in public policy really affect people's lives. I think that oftentimes we hear what's going on at the legislature and it feels so far removed from our day-to-day existence that it doesn't matter much. But things like Medicaid expansion or naloxone, there have been huge monumental shifts in our system of care that have really saved people's lives. I mean, I think we all know someone whose life was saved by the medication naloxone or had the benefit of going to treatment because of Medicaid expansion. So thank you so much for making that connection. Next, I'd like to invite Pat Fleming, the chair of USAVE, to speak for a moment.
Thanks, Evan. Appreciate that. Patrick Fleming. I am the chair of the Utah Substance Use and Mental Health Services Advisory Council. It's a state level council set up by the legislature to advise elected policymakers. I like to think of it almost as like the drug and mental health policy czar in Utah. Although we don't dictate anything, we work with partners to make changes. Thank Rob and Mary Jo and Evan and Brent for the opportunity to talk today. I think one of the things that I have been most pleased with is to see NAMI Utah and USARA Utah work together. And I'm really glad that you guys are doing this. I mean, you're both great leaders of your organizations, and you've done so much to bring the voice of recovery forward. I also want to address the recovering community. You know, we stand on shoulders of giants. There have been people that have been very active in the recovering community in Utah for 20 and 30 years, and they did their work 20 and 30 years ago. And now it's time for us to do our work. We're still more work to do in terms of policy, but as you're going to hear today, we have a lot of legislative partners and leaders who are with us, and we can't do anything here in Utah without them. And our Utah State Legislature has been very, very receptive to our message. So I want to tell you, everybody needs to be involved. When you talk to your legislators, they will listen to you. They hear your message, especially if you live in their district. And so that's the important thing to do. Never be afraid to tell your story. They will listen to you more than they would listen to somebody like me. So you are the ones that carry the message. And I'm just really hopeful that we can be together next year and even have a bigger group than it's sitting behind Evan right there, and move forward on more policy changes and helping people get their lives back together again and become active members in our Utah society. So thank you very much.
Thank you, Pat, and thank you so much for the work that you do. I think that sometimes in your position, you become the kind of the unsung hero of the recovery movement. So I want to acknowledge all the work that you do for us. It's just amazing. Next up, I'd like to invite Kim Myers to say a few words.
Hi, so grateful to be here with you all today. I'm still kind of picturing when Rob said that we'll be joining virtually and in person and in other ways. So I'm kind of picturing him like as a hologram in one of our future rallies. So excited for those days as well. You know, the pandemic and other really significant events and challenges of the last year have revealed what many people who have experienced addiction, what people with mental illness and people who experience suicidal thinking know deeply, and maybe others have taken for granted, and that's that human connection is life-saving. And this annual event, the Rally for Recovery, is such a great example of that, where we're coming together and connecting in this life-saving way, where we not only join to support the individual recovery of every one of our, you know, friends, partners, neighbors, you know, who show up, but also the connection that shared advocacy can provide in really changing our systems and our laws and our society to promote recovery and to really promote life. I think it's because of your voices of coming together that our policy makers, you know, really protected and even in some senses expanded the behavioral health budgets over the past year, in a time when budgets were being cut and they were looking at, you know, where can we save money during what has also been a, you know, potential financial crisis. But that they were protected says a lot about the foundation that you all have built of advocacy and recovery. And you know, there are so many bills that are up for debate this year that impact kind of our shared priorities, and to come together with the unified voice of does this or does this not promote recovery continues to be like an incredible platform, and just it's such a privilege to be with you, you know, all here today. And we know that there are so many paths to recovery, but that we all need community, and that addiction, mental illness, and trauma, like a pandemic, can really cause isolation and disconnection. And to survive and grow, we need each other, and we need to support one another and stay in contact. So I'm really grateful for the community of people with lived experience who have been role models for me in reaching out and staying connected of self-care, of community care, and really now more than ever turning to those lived experiences to draw on the skills and the strategies and the strength to get through hard times and come out stronger and healthier and more just and more connected. And the people that I've met through this community have been incredible role models in how to do that. And I'm grateful for your voices and for your advocacy and for showing up, and, you know, especially in hard times. And I really see the light at kind of the end of a long tunnel, and not just about, you know, a return to some sense of new normalcy at the end of the pandemic, but really a light in a very long tunnel of the reality of making the health of our brain, the mental health, our emotional well-being a true priority in our communities. And so a big thank you to everyone for that continued push.
Thank you, Kim. Thank you so much for your time. Next up, I'd like to introduce one of the representatives in the Utah State House, Representative Daley Provo, if you could share with us.
Hi, everybody. It's so great to be here. And I can't tell you how much I'm looking forward to the days when we can be back to doing this in person. I'm looking with fondness at those backgrounds of the full rotunda of advocates and survivors and the brave people that face these challenges every day and inspire the work of many of us who desire this life of public service. You are why we do what we do. And I just want to thank you for the invitation. Thank you for all of the work that you do. It's an honor to be in this fight with you. I just want to mention really quickly, I spoke last year about a bill file that I had open to create overdose prevention sites to assist our loved ones who struggle with addiction. With the guidance and sage wisdom of many of the advocates who are here, we have rethought the bill, and I'm excited that this new working group that we will be creating to look at harm reduction strategies in the state of Utah is moving out of rules and into committee for consideration, so that we can finally get some science and some collaboration and discussions with stakeholders and get some answers on better solutions and really meaningful steps forward to help everyone who is in need and to really move the needle on this, because we have so much work to do. And I can't tell you how grateful I am. I stand on the shoulders of giants, and I'm so honored for the opportunity to be in this fight with you, and grateful to everyone for helping me learn, helping me understand how to be a better advocate for these critical issues. And I hate to be the one that is ducking in and out. We have some really critical committees or bills in committee today, but please know how grateful I am for you for fighting for this every day, and for the honor of letting me be in the trenches with you. Thank you.
Thank you, Representative, and thank you so much for being such a staunch advocate of public health and making sure that people with substance use disorders and mental health conditions are treated fairly by our systems of
I love
care.
you all so much. Thank you.
All right, so next I'm gonna introduce a person in recovery who was actually a former volunteer with you, Sarah, and she's up to some amazing stuff at the legislature this year. And so I'll let her introduce herself and then her boss. But Stephanie, if you wanna jump in, you're welcome to. Oh, maybe she dropped, is she there?
Stephanie, we can't hear you.
Still not working. All right, so I will jump to, is Representative Elison still with us? And then we can have maybe Stephanie share afterwards.
Oh, can you hear me? Oh, okay. You can hear me? Okay. Okay. I'm Representative Steve Elison. Stephanie just called me and said for some reason her audio is not working. She can see us and hear us, but she can't speak for whatever reason. So I'm Representative Steve Elison, and I've had the opportunity to speak at the Rally for Recovery a number of years. It's my favorite event at the Capitol every year. Again, represent the comments of my colleague, Representative Provo. I echo that. I can't wait for us to be there in person next year. This is a virtual background, but I am kind of joining you from the virtual rotunda. So special thanks to my intern, Stephanie. We've been working on an exciting resolution. It's HCR 17, House Concurrent Resolution, and it's entitled Concurrent Resolution Recognizing August 31st as Overdose Awareness Day. And we just had this bill. This bill actually kind of has a bit of a miraculous story, because it was brought to me by my intern and a mother who'd lost her son and to overdose, and they asked me if we could get this done. Well, there, I think I see Stephanie now. The deadline had already passed for opening up bill files, so I had to make a motion on the House floor to open this resolution up. We got it drafted quickly. We got it to the committee, through the committee unanimously yesterday, and will hopefully be heard on the House floor tomorrow. So let me just, is it okay? I'll just read a couple of parts of it real quick. It's not very long, but it says, be it resolved by the legislature of the state of Utah, the governor concurring therein, whereas International Overdose Awareness Day aims to raise awareness of overdose, to reduce the stigma surrounding overdose-related fatalities, and to remember those who have died or suffered as a result of overdose. Whereas communities across our state continue to be impacted by overdose-related fatalities, as well as by the struggles of loved ones with substance use disorders and mental health disorders. Whereas International Overdose Awareness Day is a global event recognized with local events and by the lowering of the flag at all state buildings to half staff. Whereas the state of Utah has recognized the dire nature of the opioid crisis, placing Utah as high as 4th in the nation for overdose fatalities. Whereas overdose claimed the lives of 495 Utahns in 2019. Whereas Utah has widespread efforts from the legislature, state agencies, the medical community, community-based organizations such as you, Sarah, the recovery community, first responders, individual community members to recognize and act in this time of crisis. And whereas through directed efforts such as the implementation of naloxone education and access, broad opioid awareness and education campaigns, peer support services, access to treatment, and implementation of crisis receiving centers, the death toll is decreasing, and Utah is now one of only a few states with a decreasing overdose death rate. Now, if we were there in person, I would pause right there and let the chamber erupt in applause and cheering as we are making progress on this issue. So I'm just imagining the virtual reaction to the progress that we are making here in Utah. And then it finishes up by saying further, therefore be it resolved that the legislature of the state of Utah, the governor concurring therein, declares August 31st as Overdose Awareness Day and joins in the nationwide movement to raise awareness, reduce stigma, and remember those lost to overdose. Be it further resolved that the legislature and the governor encourage citizens of Utah to observe Overdose Awareness Day as a time to remember, raise awareness, and do their part to be kind and supportive of those impacted in this manner. Be it further resolved that a copy of this resolution be sent to Lieutenant Governor for recognition of Overdose Awareness Day. So that is the entire resolution. Me and Stephanie are going to do everything we can to get this passed this session. The legislature concludes a week from Friday is our very last day. So we still have to get it through the full House, ideally Senate committee, and then through the full Senate. And then of course, the signature by the governor, but we're going to do everything we can to get this done. And we'll look forward to August 31st being hopefully the official day that we'll recognize this important event in terms of Overdose Awareness Day. And hopefully by August, the governor, I was in a meeting with the governor yesterday, and he said that he's hoping that by July 4th, if the vaccine continues to roll out as it's been going, the infection counts and death counts decrease, which we're very optimistic they'll continue to do so, that by July 4th, we won't even be wearing masks. So hopefully by this August 31st, we'll be in person at the Capitol. I'll commit right now to block that date out to be there in person, and look forward to meeting all of you. Thank you for everybody who's in recovery, working on being in recovery. At this point, maybe only dreams of being in recovery. And for all of the peers and professionals that help them on that critical journey to make a brighter future for them and their family. And so thank you for this opportunity to speak with you all today and to be with you, albeit just virtually, but look forward to being together in the future. Thank you.
Thank you so much, Representative. And thank you for all your work and everything you do. You did mention that we've seen remarkable progress in this area, and it wouldn't have been that way if it hadn't been for the efforts of folks like you introducing thoughtful and meaningful legislation. So thank you so much.
Thank you.
All right. Next up, I'd like to invite Teresa Molina to speak for a few minutes.
Thank you, Evan. Thank you, everybody. My name is Teresa Molina. I'm the chair of Latino Behavioral Health Services Board and a mental health professional and a person in long-term recovery. When you recover, you can achieve the sky is the limit. But for that, we need support, we need services, and we need to see ourselves in those who are providing those services. I'd like to highlight two pieces. One is the striking down the English-only service provision in Utah. More and more immigrants, and not only immigrants, but citizens whose English is not their first language. It's a different language. So we do need providers to be able to provide the cultural and linguistic appropriate standards that needs to happen in health. And that's a legislation that has been on the floor, and we do hope it is approved. So health service providers can hire, spend budgets, charge, collect revenue for those services. On the other hand, we do need to revise a lot of the licensure pieces that happen for peer specialists, as well as therapists and counselors. There has been a huge effort to get more diversity in the workforce at all levels, including professionals and paraprofessionals, people with lived experience. But many of them, especially at the highest level, do not get those licenses for some lack of cultural awareness on their part, and also cultural bias on the examinations for their qualifications. It reaches the point of ridiculous that people with multiple university degrees cannot pass those so-called professional standard examinations because of language barriers, because of cultural barriers. And thus, our population, whose demographic is clearly changing, especially in the younger ages, are being left out of service in the mental health and the substance use. As we may see, we need more diversity in the state, representing those populations that are really living in Utah. And I'm glad we have here legislators who can hear this loud and clear, that yes, there are people whose first language in Utah is not English, and they have a citizenship status, and they should have full rights to receive these services. That's what I would like to say at this rally. And thank you everybody for the invitation. I'd like to see or hear more from you.
Thank you for your comments, Theresa, and for reminding us of the critical and ongoing work to assure equity of services in mental health and substance use care, and making sure that we're delivering services culturally competently and in a way that includes everyone, serves everyone. Stephanie, did you get your sound worked out?
Can you hear me now?
We can.
It's like a Verizon commercial. Can you hear me now?
You're good.
Yeah. Yay. Okay, so I only got to hear half of what Representative Elison said before my phone started making him sound like a choppy robot. This is recorded, right? So I can hear what he said? Yeah. Okay, thank you. I'm Stephanie Emmett. I'm a person I've been of drug addiction, of homelessness, you name it. My whole goal is to survive and get out of it. And being because of stigma to speak up or too worried about what people would think. So I'm hoping that with my internship, people will see me and see, well, I know everybody in Utah, so hopefully they recognize me and like see that it is possible that we can do something with our life and that we don't have to get stuck by shame and let that weigh us down for the rest of our life. So I was stoked when he sponsors a lot of bills that represent where I came from and what I've overcome. So it's been fun working for him. I get my steps in because I'm constantly chasing him around the Capitol trying to catch him. But it's an excellent experience, and I'm excited to be able to work with USARA still through helping with this new form of advocacy, I guess. But I don't know, maybe I'll take it further. One day I'll be a representative. But
thank you so much, Stephanie. Really appreciate it. And I appreciate hearing your perspective as someone who's working up there as a person in recovery. That's really cool. All right, next up, I'd like to introduce Representative Carol Spacman-Moss. She would share with us for a moment.
Well, good evening, everyone. It's so nice to see friends, Mary Jo and Evan and Dennis and Pat and everyone. And I'm glad you have the backdrop of the rally because I certainly miss it, don't you? Oh, it was really the highlight of this session for me. And I had to run for another committee meeting where they needed my vote. And anyway, but here I am. And I just want to say hello to everybody and hope you're doing well. I think this has been a particularly difficult time for people who are struggling with addiction, or even people who feel like they've recovered, but maybe have had setbacks. The isolation and just the anxiety has been overwhelming. I'm really pleased to say my daughter has been attending USARA's And tell me the exact name, Mary Jo. It's a family support.
So yes, it's our family support program, and we also call it CRAFT, Community Reinforcement and Family Training. And it is for family members with loved ones who they care about, who are struggling with addiction, and how to have a conversation, reduce the stigma and shame, so that they can have those conversations about somebody who's struggling with a disorder, whether it's substance use, mental health, and even other challenges that people are experiencing.
Well, it's really been a tremendous help for her as her son's struggling, and she has herself struggled in the past and has been in recovery for a long time. And I said, you know, she said things like a lot of people, oh, I can't go to counseling, I can't afford it, I can't find it, you know, I can't get someone who's insurance. And I said, text Mary Jo, and here's this program. And she's been faithful in attending it. And, you know, it's online because she's got MS. And so she really has to be cautious where she is. And so it's been a great help to her. And I can't thank you enough and the people that do this kind of support. But I think the thing that the public needs to know, and more people know, is that these services are available to anyone at no cost. And I just think a lot of people, I mean, maybe they want to get help, but they say all those things. Oh, I can't find anybody insurance. And really, it's just, there are resources there. And, you know, I just think it's a wonderful thing that you're providing that. And any way I can help in the future in any of these efforts. I don't have any bills this session that deal specifically with addiction recovery. Last year, I did another Good Samaritan bill that included bystanders, you know, and not just the person that called. And I don't know if it's ever been used, but if it gets used one time and it saves somebody, it'll be worth it. So thanks again to all of you who are supporting others or struggling yourself and have family or friends, and just know that I'm always here to support in any way I can. So thank you.
Thank you, Representative, for being such a champion up there at the legislature. Really very much appreciated. I've got a question. If people want to get more involved with legislation that they care about, how can they do that?
Well, they have to know something about the bills, and maybe Representative Ellison, who is carrying some bills that deal with mental health, and he's been a huge champion and doing so much great work in this way, can probably tell you about them. But I mean, I'm not the best person to ask right now because I'm juggling my bills here at the end and trying to follow all the ones that are existing. But at this stage in the legislature, there may still be some that are, you know, we still have a lot of we have 7 days left. So I'm not probably the best person to ask. So I would ask Representative Ellison.
Fair enough. Yeah, appreciate it. Thank you so much. I wonder, I hate to surprise someone who I did not prep for speaking, but I wonder if Dennis might chime in here a little bit about how he's become involved as a citizen in the legislative process and what that's been like for him as a family member.
Yeah, you may regret asking me, but I'll certainly speak. I've been coming to the rallies for quite some time now. It's always a difficult time for me because in everything that I do, I represent Tennyson, my son, who died of an overdose in 2015. But what I get solace out of in the rallies is understanding and even looking at the backgrounds of all the people who are in recovery. I get solace in all the good work that Mary Jo and Brent and Kim and Representative Moss, Ellison, everybody who is doing such a wonderful job of removing stigma, of helping our children stay alive, and of keeping the hope alive. hope sometimes is difficult for families. I know how your daughter feels, Carol. But with the great strides that have been made since Tennyson died in 2015, in terms of programs, in terms of public awareness, in terms of recovery programs, we are keeping more people alive, and Tennyson would have benefited from that. I always wish that he had not had his problem quite as early as he had it, because he probably would still be here today. But I just want to thank you for inviting me to the rally. And next time, be careful what you wish for. I did talk. You may not want me to, but thank you. Appreciate it.
Thank you, Dennis. And thank you for sharing about your experience and how you relate to this issue, because I think about that a lot when it comes to our advocacy work, about how we've lost far too many people. And I often wonder if some of the changes we made would have made a difference in those lives. So.
Yeah, I'll follow up. They would have made a tremendous difference. The fact that naloxone is so well used right now, and I'll just, for the benefit of people who haven't heard Tennyson's story before, he was released from his last treatment center in 2015 without naloxone, even though Carol had done a marvelous job of getting it approved with a prescription. People were not using it. They didn't send him home with it. And so he relapsed in 4 days and we had to watch him die. So the kinds of, and that's just one example, the kinds of progress in terms of policies, in terms of the great programs DSAMH puts forth, Brent, all of the things that are happening now, he would have been alive. I know he would have been alive. And of course, that haunts me, as it probably should. But I am so thankful that it's happening now. That's all I can tell you. Thank you. Appreciate it.
Thank you. Mary Jo, do you have any kind of closing remarks that you'd like to?
I do. There's a couple things. Of course, Representative Spacman Moss, Carol, because she's a friend. You have, your legislation over the years has saved lives. Working with Utah Naloxone, Dr. Jennifer Plum, and further the Utah State Health Department, our State Division of Substance Use and Mental Health, USAVE. I mean, we have made a tremendous impact on saving lives. And substance use is sometimes the only way somebody knows how to cope. We know the kind of the dark side of people when they're struggling with their mental health, and substances as a way to cope with that, or destructive behavior or isolation, and suicide and substance use and overdoses and accidents that happen. I mean, we can prevent that. We can prevent this from happening. And I think that is all of our work and all of our voices sharing about that. And if we save lives and we prevent people from being alone in their darkness, we can absolutely help them get to hopefully the other side. It's not easy, and oftentimes that those early years of just coming out of those dark places are really difficult. But we do celebrate people in their recovery and their successes, because they're important to us. Something I did want to also add, we have a family member here too. Also, I want to say a few family members. Dennis has become one of our most important advocates as a family member, with tremendous loss. And that always hurts my heart. I lost a couple people just a couple weeks ago from an overdose, and my heart's still grieving. And I know Dennis knows exactly what that's like. And I appreciate all that you do for the citizens of Utah, Dennis, and joining, what we do to make change in our state, and to find the solutions to help people have access to treatment for their mental health and substance use. And I also think it's important, we have a family member here who has joined you, Sarah, who has a loved one in recovery, and getting to carry that message about how it impacts their lives is important. So I wanted to introduce a young person who is beginning this journey with us, and it's Teresa Kim, and she has joined our support in helping family members understand more about the possibility and the path of recovery. Teresa, could you say a few words?
Yeah. Hi, everybody. Thanks, Mary Jo. I'm happy to be here. Yeah, I'm still pretty new to you, Sarah. I guess I started in July of 2020, which is always weird. During the pandemic, not much going on. So I'm sad I didn't get to go to this rally, but it really gives me hope to see everyone that packed the Capitol, because when my sister was going through her substance use disorder, I felt very isolated, my family as well. And there was still so much stigma back then. I can happily say she's now 8 years in recovery as of Monday. So that's really awesome. And she really has, built a relationship again with our family. And it's really important to me to be an advocate and to do what I can and have a small part in just helping those find hope family members, and hopefully we can get the attention of those not yet in recovery to help support them. So yeah, thank you.
Thank you so much, Teresa. I really appreciate you sharing a little bit unprompted. Thank you everyone for joining us tonight. I really appreciate everyone's time and being here and spending the time talking about the issues that are faced by people in recovery from substance use and mental health disorders, and really promoting a message of hope, hope for a brighter day. And thank you for all you out there for attending tonight. We appreciate you coming, and hopefully sooner than later, we'll see you in person again. So have a great night, everybody.
Thanks so much.
Thanks, everyone.
Thanks, everyone. Have a good night.
Thanks. Good night. Thank you.
Bye.
We'd love it.
Turn. Oh, there we go.
There you go.
Hello.
Hi, Representative Dunnigan. Glad you could join us. I know you're really busy and probably just popped out of a meeting to be here. So we definitely would love to hear from you.
Well, thank you very much. So it's great to be with you, and my committee meeting's still going on, but anyway, love speaking with you folks. May I tell you just about a couple of things I'm working on?
Yes, please.
Okay, so one is, I'll give you an example. We have a person that's homeless. They have some mental health crisis. They go to the emergency room and they're treated, and then they're released. The problem hasn't been solved. And so they're back in the ER a few days later, and it's kind of a cyclical thing. Or maybe they're admitted to the hospital for a couple of days, but the hospital's not going to keep them long-term, and so they're released, and we still haven't solved the problem. So I have legislation that's actually passed the House and the Senate and awaits the governor's signature to create a pilot program for medical respite. And so this is what would happen in this scenario. They're taken to the ER. Remember, this is a homeless person, and they're enrolled in Medicaid. And then instead of being released to the streets, they're taken to a medical respite facility, which is kind of like a skilled nursing facility, but a little bit different. They have a place to stay, they get medical care, they get food, they get the nutrition they need, and they can stay there for probably an average of a couple of weeks, and they get stable. And so, and the same thing if they're admitted to the hospital. Sometimes the hospital's keeping the person admitted for a day or two longer than they really should, but they don't want to release them to the street because they know they haven't addressed the issue. So that the hospital, inpatient or ER, could release them to the medical respite. They'll get care in the respite, and then upon stabilization over 2 or 3 weeks in the respite, they'll be taken to maybe a resource center or some other place where they can get some care and treatment. So we think this will be much better care for the person and get them stable, and we'll get them enrolled in Medicaid, which will help them as well. and also better for the system, a better use of dollars. So another thing I want to mention is I was recently asked to serve on the Criminal Justice Advisory Council for Salt Lake County, which is a great team and made up of players from the criminal justice system as well as behavioral health. A lot of the behavioral health folks are there. And then within that, they've created a working group to work on getting IDs for people who don't have IDs. And we know how critical IDs are to get a job, to get transportation, to get benefits. I started a pilot program. I worked with Sheriff Winder several years ago to start a pilot program. So each week they take a van of incarcerated county prisoners or inmates to the driver's license division, and we help them get ID or get their driver's license back. And we've been doing that for several years, and that's good, but it's a small scale. So I'm very happy that we had some folks at the U of U that did a study on this and kind of showed what we already know, that you need an ID to succeed. And so we're going to come up with some ideas now of how we can help people get IDs, a state ID or a driver's license. It'll help them get employed, help them get benefits. And I'm really excited about that, to try to broaden that. It's a much bigger need, a much bigger problem. So we're hoping to address that. And that's about what I have.
Again, I really appreciate you coming by, and I'm glad we were able to get you. So thank you so much for taking the time to come and speak with us tonight.
It is my pleasure. I remember the rally last year, or the year before, and the year before, and I miss having everybody yelling and screaming, so I go deaf in the rotunda and all that enthusiasm. But I know we'll continue it on, and hopefully next year you'll be back in the rotunda.
Absolutely. Thank you so much.
We'll be back. Thank you, Representative Dunnigan, for all you do.
Thank you.
So that's a wrap.
Yep.